When did you first become interested in pycnogenol? What grabbed your attention about it, particularly as a healing agent? You're a physician, you know?
Well, really what brought me to pycnogenol was when I was doing research for my book called The Allergy and Asthma Cure.
Okay.
And I was looking for nutritional supplements to recommend, and I was looking, and actually it was something I'd been recommending for a while before that.
Okay.
So when I was doing the research on that, that's when pycnogenol came to my attention. What are we really going to do to help naturally with people with allergies, with asthma, with eczema, with rosacea, all of those types of things, because they're all kind of similarly related. They're all inflammatory conditions that happen in the body. So I was looking for something that was anti-inflammatory. I was looking for something that had research behind it. And that's when I came across pycnogenol. And pycnogenol has, for me, as a doctor, I always like to recommend things to patients that I know work, or at least that the companies have tried to do some research behind it. And I was shocked to discover 40 years of research, 280 scientific publications on this, and specific studies looking at allergies and asthma and the reduction in symptomatology. And there's actually just a very recent study that just came out on pycnogenol and reducing the symptoms of hay fever. So allergic rhinitis, or whatever you want to call it, you know. And I think most people just want to get rid of the runny nose and the itchy eyes, and that feeling that you get in your head, and just feel so awful. And there was an interesting study that just came out about pycnogenol and hay fever symptomatology, and it showed that if you take it before your season, if you happen to have a season, you take it for about 6 weeks before your season, drastically reduces your symptomatology.
It does.
And the longer you take it, and they measured it at 30 days, 60 days, and 90 days, and the longer you take it, the better your reduction in symptoms are.
Wow, because I mean, I had a friend who had hay fever, and it started in the summer, and he was carrying a handkerchief with him the whole summer up until the fall.
People can be miserable. I'm blessed. I don't have allergies, which is great. But people are miserable. It's one, yes, I mean, it doesn't cause you to die. I mean, asthma can, but allergies certainly don't for the most part, unless it's a food allergy where you get anaphylactic and your throat closes. And so yes, I mean, I shouldn't use such a broad statement like that. But for the most part, it's just a debilitating illness that just makes people miserable. And then you take some of those drugs that either make you sleepy or make you hyper.
Or dehydrate you.
I mean, it's really just, it's nice to have a natural substance like that I can turn to, like pycnogenol, that will reduce the symptomatology. But the real key is that people have to take it, and you have to load your body up with it, because pycnogenol will stay in your body for 24 hours. So if you load yourself up with it, you're building up a reserve in your body. You're actually getting the other antioxidants in your body to work, because that's what pycnogenol does. It helps the other antioxidants like vitamin C and vitamin E and other things in your body to work. It works on oxidative stress. It works to reduce inflammation. So all of those things, when you do it long enough before your allergy season.
And that's the key, isn't it?
Absolutely, because I always call it, take care of your internal environment. Because if your internal environment is healthy, then the stuff from your external environment isn't going to be that dramatic for you.
Well put. Thank you so much.
Thank you.